Welcome to Cardiovascular Matters. Whether you are looking for answers for yourself or someone you love, we are here to give you the best information available. Each week, the founder of Cardiovascular Institute of the South, Dr. Craig Walker, and medical device sales veteran Terry Roberts discuss the causes, symptoms, treatment, and prevention of health-related issues stemming from cardiovascular disease. Now here's your hosts, Dr. Craig Walker and Terry Roberts.
Hey everyone, welcome back to Cardiovascular Matters. Again, thanks for everyone that's been subscribing and listening or watching the podcast. And again, if you want to subscribe, it's free. Just click on the button and you'll be notified when new episodes are released. We try to do one a week, and we're pretty good about that. But with Dr. Walker's travel schedule and my fishing schedule, we sometimes it may be one a month or a couple a month, but we're getting them out there. Today's topic is on pelvic congestion, and honestly, it's something that I'm not as familiar about. I'm going to turn this over to Dr. Walker, and I'll try to come up with a couple questions as he describes this situation with us. Dr. Walker?
Thank you, Terry. Pelvic congestion is something that is fairly common, and it can absolutely be disabling to people. So pelvic congestion is when the venous outflow from our pelvis is, for some reason, not ideal. We're simply, and therefore we get congestion of organs. Now, in men, this can result in problems such as varicocele or large collections of veins in the scrotum.
Yeah.
But in women, it can be yet far more devastating. And it's more common, by the way, in women. In women, this can result in very, very heavy menstrual cycles, in severe pain with sex, with the likelihood of having greater risk of miscarriage with pregnancy. It has a lot of symptoms. And what it has to do is decreased drainage of the pelvis.
Okay.
Now, arteries carry blood to our organs, and then veins drain those organs. And if we don't drain them, then what happens? These organs swell up. The pressures go up within those because we're simply not draining the blood supply that comes there. So there are many potential causes. So perhaps the number one most common cause is something we call May-Thurner syndrome.
Right.
Now, May-Thurner syndrome occurs when the aorta, the major artery going down to the legs, when it divides to go out to both legs, the arteries that it divides into are called iliac arteries. Now, the aorta is to the left in our body. It's to the left of the vein, the vena cava, which is returning blood. So, and the vena cava, the two vessels that lead into the vena cava returning blood, are called iliac veins. Now, when this right common iliac artery comes off of the aorta, it first crosses the left common iliac vein, then the right common iliac vein, and it can compress those veins against the backbone.
Okay.
Also, where the artery further down, where it divides to either go again to our sexual organs or go out to the legs, at that point, it can be obstructed by that artery called the hypogastric artery. And that can result in compression of a vein and therefore suboptimal drainage of the legs and as well as these other areas. Now, typically in May-Thurner syndrome, we see a lot of leg swelling. Okay, but there are certain conditions where we can still have pelvic congestion and the legs don't show up. All of the symptoms are just right there in the abdomen, and all of these symptoms that I've mentioned before occur. Now, if we see this problem that we've just mentioned, there's an easy fix to that, and that is ballooning and putting a springy type stent, one that's open in its native state, to just simply hold the vessel open and to stop compression of those vessels. Now, in the case of iliac vein compression, there's another reason to treat, and that is the risk of clot formation in that, because we're slowing the flow of blood down. Now, But there are many other causes that we have to know about with pelvic congestion. I've seen a case this week of a lady who had a fibroid tumor in her uterus. And this fibroid tumor was such that it was bigger, certainly, than a softball, and perhaps almost as big as a volleyball.
Oh, my goodness.
And this was compressing her vena cava and both iliac arteries, because you've got this big thing there doing this. And she was having all sorts of symptoms. This was really making her life very miserable. And we did a CT. We often do a CT when someone has suspected pelvic congestion, because we can actually see the compressed veins and compressed vessels with this. Well, she had compressed vessels, but not because of an artery compressing them, but because she had a huge uterine fibroid. And again, that can be treated. That can be treated in several ways. Obviously, historically, the way that we treated a uterine fibroid was to cut out the uterus, get rid of that totally. However, in today's world, there's also an option to treat that with embolic treatments. I don't do that, but there are many people who do. And so uterine fibroid embolization is a technique by which a physician can go in and actually find the arteries supplying those areas and actually occlude those areas. In other words, put either coils or sometimes medicines such as glue or other things which block the blood flow there. That causes that area to die, and it can shrink that area tremendously.
Right.
That is particularly useful in younger women who still wish to get pregnant. If one uses uterine fibroid embolization, many of those women can go on to still conceive. Whereas if the uterus was removed, that is an option lost. And so certainly we have that option that exists as well. There's another situation, and we call this nutcracker syndrome. So in people, the left ovarian vein, which helps to drain the pelvis, drains into the renal vein or the kidney vein. Now, if there's a blockage at the origin of that kidney vein, again, it's an anatomical reason, it gets compressed there, then this drainage doesn't happen. And so blood backs up, these organs swell, one gets pain in the abdomen, feel bloated all of the time, have heavy menses, and these other issues. And that's treated by stenting the origin of that renal artery. Now that is relieved. If that ovarian vein is very big and it is still refluxing, then once again, one can close that vein because there are alternate routes with which it can drain. And then we can remove those high pressures imposed by the leakage of that vein. So all of these things are a syndrome, which is called pelvic congestion. Once again, I cannot tell you how many women I've seen who are called hypochondriacs. They have chronic pain, other things, and I've got to tell you, you've got to pay attention to symptoms. I've seen these people doped up with lots and lots of anti-anxiety medicines, pain medicines, you name it, but that's not getting to the source of the discomfort. So, the first test in evaluating for this is a fairly simple test. It is just a venous ultrasound. One that carries no risk, no pain. And one looks at the veins to see, do we have insufficiency of these veins? Do we have this? And a more sophisticated ultrasound could be an intravaginal ultrasound in women that gets up closer to these areas. And you're looking for what we call pelvic collaterals, or vessels that go across. We're looking for varicose veins. And many people who have this, women who have this, will often have pelvic vein. It will have varicose veins in their privates. Again, that's one of the reasons that there's pain involved with intercourse or things such as that. This has ruined many people's lives in terms of, intimate relationships and others, and was just simply not diagnosed. This has become a huge issue. And there are many people who've really specialized in this. In particular, quite a few women that I know women physicians have really specialized in this problem, which they recognize to be common and to result in tremendous disabling symptoms. But the first part is making the diagnosis, understanding what it is, a physical exam, a venous ultrasound, and if that doesn't give the answers, a pelvic CTA. Now, pelvic CTA simply is looking at the lower part of the abdomen down towards the genitals, not looking above or below that spot. And one gives contrast and makes an image. They see the arterial phase of everything. And then we wait for the venous return. And then we make an image during the venous return. And that will show us if there's a compressed iliac vein. That will show us if there's a uterine fibroid, as I've mentioned in this case. And when I explained to the woman and showed her this big fibroid, now she was a little older and pregnancy was not important. She says, well, I think I'd prefer getting it taken out, which is fine as well. And that's certainly a good option. But let's say this woman had been in her 20s or early 30s and was hoping to have a family, then obviously I think something like uterine fibroid embolization would have made sense for her. But it lets us see all of these things, and once again, takes the unknown, makes it known. And it has been my experience, once people understand, they know the problem in front of them, it is much easier for me to treat, but secondly, it's much easier for that person to deal with this, because all of a sudden they then understand the pathology and it makes sense to them. And it gives them the relief of understanding a problem that they have.
Mm-hmm. That's interesting. And good points about the treatment of those fibroids too. That new embolization techniques have just, I think, the last number of years been made available, where before it was just a surgical removal. So that's great information for patients to know.
You know, this patient, Terry, because there was so much abdominal discomfort and stuff, had been through multiple endoscopies and proctoscopies and colonoscopies and
oh my goodness, all
of these things. And she says, you know, doctor, I was starting to think maybe I was just a hypochondriac. And she had this massive, absolutely massive uterine fibroid that I'm sure would have been checked up in a cardiology office. We don't do the pelvic exams, of course, but you know, patients come and they speak to me. This lady had come to me because she was also having some edema in her legs. And that's because this was congesting. It was congesting it was compressing the vena cava as well as both iliac veins.
Wow.
And she says, well, I heard some of my friends say this got relief. And of course, when we're working these problems up, we have to look at the entire differential diagnosis of what this could be. And I'll tell you, this pelvic CT was, when I saw it, I was like, oh my golly, this is real pathology. And yet, from the outside, you would never know.
Right.
You would never know.
That's amazing. So if you're a patient out there listening to this information today, and you've got these issues, look to your provider to get this looked at. But if not, you can go on www.cardio.com, and all of Dr. Walker's group is very holistic in their approach, and they can hopefully get you diagnosed and get you a pathway back to good health here. But thanks again for listening to Cardiovascular Matters. Again, if you want to subscribe, it's free, and we'd love to have you part of the family here. Also, if you have questions about topics you'd like to hear about, just put those in the comments section. I'll get those to Dr. Walker, and we'll tackle as many as we can do. Thank you very much for listening to Cardiovascular Matters.
Thanks for listening, and please subscribe, like, and share this podcast with your friends and family. Join us next week for new topics and answers with Dr. Craig Walker and Terry Roberts on Cardiovascular Matters.